Hey guys, Dr. Dobson. We're going to be doing some Class 5 and Class 2 dental restorations in this video. Here's some trailer footage, and we'll get into here's some photos. Class 5 on the 2.7 there along the gum line we're going to be restoring with some cord for retraction, and a Class 2 that had a filling fallout of it. 3.7 also had a gum line cavity, so we'll be fixing that one. Here's some x-rays. Gonna have a couple of announcements. The first thing is a PSA that E1 and E2 caries do not need to have restorative intervention. This patient's about my age, middle class individual, looks healthy, and every single tooth has an MODB. And you look at something like this and you say, I'd love to see the x-ray that was taken that diagnosed the need for restorative treatment on teeth like this, because I think generally dentistry is way too aggressive when it comes to Class 2 lesions. They don't progress as fast as you think they do, especially with oral hygiene instructions. The other thing is that my video editor has been fantastic for me, and I see a lot of people actually making YouTube channels sharing dentistry, which I think is great. And I wanted to give him a shout out. His name is Francisco. Hails from Argentina. He's a dentist as well, and is great with editing videos like this. So if anybody wants to get a hold of a great dentist that has a knack for video editing and a hobby, then I'll leave his email in the description. I won't be posting dental implant cases to this channel anymore because of harassing, toxic comments. I'll probably be making a Patreon for those, and all the proceeds of that will be going to a pro bono fund for cases that I'll post exclusively to Patreon. So that will be coming soon too. Anyway, we'll get into the case here. There was a 2.5 MOD that we did because the MO restoration fell out. The 3.7 also had a massive filling that had debonded, and caries was beginning to develop into the dentin. So we're going to do a filling on that tooth. No symptoms pre-operative or post-operatively. And then some Class 5 lesions on the 2.7 and the 3.7. So we'll get started with the footage here, and we would have frozen with Articaine, and we're going to do the 2.7 first, going to excavate the gross caries with a large round diamond on a high speed, and I'm going to be fast forwarding a good amount here. And I usually like to do the initial reduction and outline form with large round diamond for these, and then go in with a slow speed to remove any soft tooth tissue. So here we are with the slow speed, small round carbide, and we're just using kind of tactile sensation to determine when we're back on healthy dentin around the DEJ, and the pulpal aspect of dentin can be left as affected dentin. So here's a intraoperative. There's still a little bit of decalcification along the distal surface that we're probably going to want to remove, because that's an area where recurrent caries could develop. So we'll continue along here. We're going to get a cord in to retract the gum tissue. This is a situation where we could say that we don't need to use the electrocautery tip because it doesn't go quite subgingival enough to warrant that. So we'll go with one pass, and we'd like to see maybe a little bit more retraction on the buccal. So we're actually going to take the cord and double it back so that we have kind of two cords along the buccal surface there. And then we're going to be satisfied with our gingival retraction. So we'll continue prepping and just removing any decalcification of enamel along the DEJ, which is good practice. And then there's the final prep. So we're going to restore this here with Fuji 2. And I like to condition the surface of the tooth with a 5-second phosphoric acid etch. Thorough rinse, and then a thorough dry, and then we'll apply our material, Fuji 2, keeping the tip deep into the lesion so that we don't develop any air bubbles. And then we'll pack it down to the margins with a moist cotton pellet. And it looks like there may be some trauma to the cheek from the procedure, which happens, and we'll tell the patient it might be sore for a couple of days. There's the final lesion restored, the 2.6. sorry, the 2.7. So we're going to restore the 2.5 now. We're going to get a rubber dam on the 2.6, and then just finish applying the rubber dam here. And then we'll get going on the 2.5. This is a tooth that had an MOD composite. The MO portion of the composite debonded, and then now the patient has an actual problem that needs to be fixed. Because I didn't see the initial, I would like to have requested this patient's historic x-rays to see what the teeth looked like before an MOD was done on every single one of these teeth, but we don't have that luxury. So there's the distal prepped, and now we'll prep. Sorry, that was the mesial. Got confused because of the mirror, and now we'll prep the distal. Going to fast forward through most of the prep here and using indirect vision for the distal surface there. And we're going to use a flame to open up the contact. Still a little bit of decay in the distobuccal aspect there that we'll get in, remove. Use a flame to open up the proximal contacts and remove any sharp enamel, unsupported enamel. And then once we have mostly hard tooth tissue, there's the final prep there. We are going to matrix with a couple sectionals. Use the plastic stabilizing wedges, and then we'll apply our separator rings. Mesial goes on first, and then the distal, and I'll usually give them a little bit of a shake to separate the PDL as much as we can for nice tight contact. Give them a little shake. And the purpose of that is to separate the neighboring teeth, push them as far away as possible. And then we're just going to burnish the matrix against the neighboring tooth. And then that's going to be ready to restore. So we'll do the same thing. We'll etch for 5 seconds with phosphoric acid, thorough rinse, thorough dry, and then we're going to apply our restorative material, which is going to be Equia Forte in this case. And keeping the tip down low so that the air bubbles don't form, and then packing it in with a moist cotton pellet. This is a time set material, so we're gonna leave it for 5 minutes and then come back and finish the restoration. So here we are back. The separator rings are off. Sometimes we'll actually do some excess restorative material reduction before we can remove the matrices if it goes a little bit over top of them, which is what we did in this case. And I'll usually, matrices are removed there. We'll start checking the bite. Usually have the patient say bite and slide very lightly at first, and then I'll say bite down and grind a little bit harder if we don't see any marks, and say bite down and grind as hard as you can. Before we can trust that there are no high spots. And there is a high spot when we have the patient bite and grind as hard as they can, so we'll whack that down with a large carbide on slow speed, and then we'll varnish it with Equia coat, cure that, and that one's good to go. Check the contacts with floss. And then we'll move on to the next tooth. It's going to be that 3.7 MO that had the filling debond, and then it was just kind of stuck there floating and causing the dentin to decay. So we'll remove the mesial portion, and then we'll prep out the occlusal material, the old filling, before making our proximal box. And there's a progress photo. And gonna remove all of the old composite. Sometimes we'll use a slow speed just to get so we can have a dry tooth to visualize where the old material is. so that we don't remove any more tooth than we need to. And once we're sure that all of the old composite has been removed, then we'll refine the mesial box of the 3.7 and remove the tooth decay, cleaning up the DEJ thoroughly, but not extending the prep too far pulpily. There's a progress photo there. Still a ways to go with the caries reduction. And we're going to use this little cariesectomy burr that I got from Strauss that seems to work okay. And just refining the proximal box, making sure that there's no more tooth decay. The blood is coming from the gingiva, not the pulp. Do some refinements from the 9 o'clock position. Still a little bit of decay that we'll get out with our slow speed. That photo was from before. But once we're satisfied, then we'll matrix the tooth, and we'll have another photo before we restore, I believe. Making sure we have all of our caries out. And there's the tooth ready to restore with clean DEJs. A little bit of tissue in the gingival margin of the filling, which I don't think is going to be too much of an issue. So we'll restore with Equia Forte, and same protocol, overfilling the cavity with the material, and then packing it down with a moist cotton pellet, waiting for 5 minutes for the material to set, and then disassembling the matrix and doing our gross reduction with a large round diamond before switching over to a slow speed large round carbide, and just taking it back down to the original margins before starting to check the bite. Check the bite. Still a high spot there. And once we're satisfied with occlusion, then we'll just kind of smooth everything off and then coat